One very interested party in the health care debate has been relatively silent the past few weeks. But insurance companies will play a central role in whatever happens after Obamacare. Correspondent Doug McKelway has that part of the story tonight.
If you owned a car, had no car insurance, and this happened, no prudent insurer would cover you retroactively and pay for what might be called your car's pre-existing condition. Yet, in its most simplistic form, that is what health insurers have been asked to do under Obamacare, and may be asked to do with a Republican replacement. As the creator of America's first insurance company, Benjamin Franklin would have understood this problem.
And he actually charged people who lived in wooden houses more than he charged people who lived in brick houses because they had a higher risk of having a fire. That's what insurance is about, spreading the risk over population.
Like cars or buildings, people with pre-existing conditions are more expensive to insure. The compassion they may deserve does not undo the hard, cold math for insurers, and may explain why no insurer would agree to an interview with us today.
This is a situation where they can't win. Under the current law, they're departing the marketplaces. There are 5 states where there's only one insurer. A third of all counties, there's only one. Premiums are going up. So they're losing there. They can't make any money.
That, despite lots of taxpayer help to cut insurers' losses, subsidies in the form of cost-sharing reductions, tax credits, risk corridors, and high-risk pools. Despite all that propping up of insurers in Obamacare, this map shows the losing battle. The areas in orange are counties that are down to one health insurance provider. To many Democrats, the math doesn't matter.
If Republicans have their way, Americans with pre-existing conditions will be pushed off their insurance and segregated into high-risk pools where they will face soaring costs, worse coverage, and restricted care.
The irony is that Republicans seem intent on adopting some of the same components of the health care law they once disparaged.
There were bailouts when it was a Democrat idea. Now it's a Republican idea. They keep sweetening it up.
Our trouble as a nation is the bill's too big. And that's not the insurance company's fault. That's the doctors, the hospitals, and all those other providers.
A former insurance company executive recently wrote, "There are 2 things that health insurance companies hate to do: take risks and pay claims. But it's also the very essence of their business and will be demanded of them no matter how the health care bill takes shape." Chris?
Doug, thank you.